Hi, my name's Danny Hansen. Today I'll be making a video assessment of a patient with congestive heart failure. My patient presents to the clinic with signs and symptoms of congestive heart failure, shortness of breath, peripheral and dependent edema, and ascites. The three most affected systems of this disease are the cardiovascular, the lungs, and the abdomen. Come on in here, Mr. Robertson. Have a seat. Here. So why don't you tell me why you're visiting the clinic today?
Okay, well, I have trouble walking to the mailbox because I can't breathe as well. And as you can see, my feet are swollen up. And recently, I just gained a lot of weight in my guts.
Okay. So you're short of breath easily? You can't even make it to the mailbox? Okay. And you've had a lot of weight gain recently, especially in your abdomen?
Yeah. Okay.
And it looks like your legs and your feet are all swollen up. You can't even get them in your shoe, huh?
Yeah.
Okay. All right. So tell me about your health history. Do you have a history of diabetes or high blood pressure?
Yeah.
Both of those?
Mm-hmm.
Okay. What about, are you a tobacco user or do you use alcohol?
Yeah, sometimes I go to the casino and smoke and drink.
Smoke and drink, okay. Are you on any medications?
Yeah, I take pills every day.
For your diabetes and high blood pressure?
Yeah.
Okay. Alright, well, why don't you lay back there and we'll do an assessment on you.
Whoa, give me up.
Alright, let's put you up a bit. Probably kind of hard to breathe while you're laying down. Interesting. Alright. I'm going to take your blood pressure real quick. We'll start there. Well, it looks like your blood pressure is a little high. But you already knew that, right?
Uh-huh.
Okay, Mr. Robertson, I'm going to have a look at your neck veins. We can pull your beard over a little bit. Just going to feel those vessels in your neck. That's your carotid artery there. Okay, I'm going to let's have a listen to those. Okay, interesting. Now we're going to do a little measurement, see if we can measure your venous pressure here. Okay. Alright. Interesting. Looks like you have some increased pressure there. Okay, now we're going to do what's called a hepatojugular reflex test. So I'm going to have you lay there like that and try to breathe quietly, breathe normally with your mouth open. And I'm going to push my hand on your upper right quadrant and just below your ribs. I'm going to exert some pressure here for about 30 seconds. And we're going to see if your jugular veins are elevated.
Okay.
Are you ready? So just breathe normally. Okay. So it looks like your jugular veins are elevated while I'm holding pressure here. Okay. Just going to inspect your anterior chest here for symmetry. Okay. Alright, Mr. Robertson, now I'm going to palpate your apical pulse. I'm going to have you inhale and hold your breath, and I'm going to roll you onto your left side, okay?
Okay.
Okay, so take a breath and hold it. Okay. Alright, let's roll you back this way now. I'm going to palpate your precordium. See if there's an enlarged heart can tell us. If you have an enlarged heart, then sometimes that's an indicator of congestive heart failure. Okay. Now I'm going to have a listen to your heart sounds. Well, Mr. Robertson, I heard an extra heart sound in there. They call that an S3 or an extra gallop. That can be indicative of heart failure sometimes. Well, Mr. Robertson, I thought I heard a heart murmur when I was listening to your heart, so I'm going to have you change positions and sit up here, and we'll listen to that heart again and see if I still hear that murmur. Okay, so you may have a heart murmur. That's something that we'll want to check into. All right, Mr. Robertson, I'm going to assess your lung system now. So let's go ahead and have you swing your legs around there. We'll start on your posterior side. I'm going to assess your tactile fremitus. So I'm going to put my hand on you here, and I'm going to have you say the word 99, okay?
Okay.
So say 99.
99. 99. 99. 99. 99.
Okay. Just going to check. Take a deep breath in and out for me. Just going to assess your lung fields here. I'm going to take a listen to your lungs on this posterior side.
Okay.
Take a deep breath in and out. Let it out slowly for me. I hear a lot of crackles and wheezes in your lungs. Do you have a cough?
Yeah.
Sounds like you had a cough for a while. I hear a lot of adventitious breath sounds here. Sounds like you might have some fluid build up in your lungs.
Okay.
Alright, Mr. Robertson, I'm going to percuss your posterior chest here.
Okay.
So I'm just going to do a little tapping sound. We're just listening for any high-pitched or dull noises here. On your lung fields. This will kind of tell us if there's any masses in your lungs. Okay. Alright, Mr. Robertson, I'm going to have you take a deep breath in and out. I'm just checking for symmetrical expansion in your lungs here. Okay, that looks good. So now I'm going to assess for tactile fremitus, so I need you to repeat the phrase 99 as I touch across your chest here. So
99.
Okay.
99. 99. 99. 99. 99. 99. 99.
Okay, now I'm going to percuss your anterior chest here. So I'm just going to listening for the timpani of the sound here. We're listening to see if we have any dull notes across it, the lung fields, or any of that. So that all sounds pretty good here. I'm going to go ahead and listen to your lungs on the front here. So if you can take a deep breath, let it out slowly for me. Okay. I can hear some crackles and wheezes in there.
Yeah.
A lot of adventitious breath sounds. And you said that you've had a cough for some time, is that correct?
Yeah.
Okay. Does anything come up with that? Is that a productive cough? You get some sputum up with that? Okay, that could be indication of heart failure. Okay, well, let's move on to Mr. Robertson. Now I'm going to assess your abdomen. Can you tell me if you've had any diet or nutritional changes recently? How's your appetite been?
Well, I haven't been that hungry and my gut's been getting big. Bigger and bigger. Okay,
so you're not eating as much. You're not very hungry, but it seems like you've gained a lot of weight in your belly. Is that right?
Yeah.
Okay. All right. We're do a few tests here. We're going to check and see if maybe your liver's enlarged, and also if there's any fluid, if you're holding any fluid down here in your flank. That may be an indication of heart failure, so we'll do those two tests now. Alright, Mr. Robert, I'm going to check and see if your liver's enlarged now, so we're just going to kind of feel over it and see if we can figure out where it's at. Okay, I'm going to make a mark right there. I can feel one edge of it. I'm going to move down and try and find the other edge of it. Okay, right there. Okay, I'm going to take my ruler here and okay, it looks like your liver may be enlarged a little bit. Okay, so check your abdomen here. It feels like it's a little distended, pretty tight there. You know, your skin's pretty tight. I'm just gonna have a listen for your bowel sounds here. Okay, Mr. Robertson, I'm going to do a what they call a fluid wave test. So I want you to put your hand right here in the middle of your belly there, and I'm going to hold on this right side of you and tap over here, and we're going to see if I can feel a fluid wave over here. Okay, so I have a positive result on the fluid wave test. Okay, Mr. Robertson, now I'm going to check for ascites buildup in your abdomen there. So I'm just going to feel over it and kind of tap it and see if there's a change in the node of it. So it's kind of, it gets dull on the sides, and that indicates a fluid buildup, you know, right here where we can see that fluid build up. So, well, Mr. Robertson, based on your signs and symptoms, the shortness of breath, the productive cough, your reported weakness and fatigue, you were positive for jugular venous distension, you've got some ascites in your abdomen and an enlarged liver, and it sounds like you've got some nocturia, that's urinating a lot at night, and also some unable to lay flat. You've got to stay up on the pillows, and the doctor is going to want to order some tests on you to confirm the congestive heart failure. So they're going to do some blood work on you, draw some blood and do some labs. They're going to do what's called a BNP and see if that's kind of indicative of heart failure, if that number's up. And he's also going to do some imaging. They're going to want to do a chest x-ray, an electrocardiogram, an echocardiogram, a whole bunch of tests, kind of take a look at that heart, see if they can tell where the abnormality might be, and that'll kind of let them know from there. The doctor may recommend some medications, probably a diuretic to get that water off of you, so that'll increase your urination, and also an ACE inhibitor probably to start with. So, all right.